Well, thanks, Sammy. Just want to say welcome again. We're so glad you all joined. I'm Peggy Shea. I'm a research analyst on the team, and today I'm joined by,
Hi, my name is Alex Chen, and I am a data analyst on the dashboard team.
and we're also joined by a few others of our team. And so before we get started, we'd love to learn more about you. So if you haven't already, feel free to introduce yourself in the chat box. Please let us know what city or organizations you're from, whether you're new to the dashboard or have used it before. In today's session, we're going to start with a brief intro of the dashboard, followed by a demo highlighting its features, and then focusing on how to access our data. And we'll leave most of the time for your questions and issues. Next slide, please. So the goal of our dashboard is to help cities across the US leverage the power of data to improve the health and well-being of everyone in their community. And we created the dashboard with the ultimate purpose of helping mayors and city leaders improve the health of their citizens. Most of our data on health and drivers' health are not organized at the city or neighborhood level, but rather at the county, state, or national level. And the dashboard has really changed that for over 750 US cities. And this includes all cities with a population of 50,000 and higher. And as you can see on the map here, our cities are colored in blue. So the dashboard launched in May of 2018. It was developed by our team at the NYU School of Medicine Department of Population Health in close collaboration with the NYU Wagner School, the National Resource Network, National League of Cities, and ICMA. And in developing the dashboard, we worked really closely with city partners on everything from measure selection, website development, implementation, and user testing to create an easy to use one-stop resource to help create healthier and more equitable communities. We're an academic institution, so it's really important for us to get those real-world city perspectives when designing the tool. And of course, our dashboard is always having ongoing improvement and upgrades. So the City Health Dashboard is flexible and it can be used in a number of ways. Some examples include comparing health gaps across neighborhoods, comparing your city to cities in other regions or similar populations, setting priorities and better targeting resources. And as you can see in the image here, the dashboard data shows how life expectancy can be very different, even in neighborhoods that are right next to each other in Columbus, Ohio. So we apply really rigorous criteria when we select measures to the dashboard. This includes using national data sets, having rigorous methods underlying the original data collection, reflecting public health priorities, being amenable to city level intervention, being updated regularly, and being balanced over 5 overarching domains. And all of these selection criteria really help us ensure that our metrics are comparable across cities and have up-to-date data. Here you can see we've listed all the metrics on our dashboard across the 5 domains. And in blue, you can see these are our metrics that are available at the city level data only. And in yellow are all our metrics that are available at both the city and neighborhood level. And here are our measures listed by data source. So you can see each metric with its respective data source next to it. Some of these data sources include the National Vital Statistics System, the 500 Cities data set, and the American Community Survey. And now we're going to provide a brief demo of the site. probably a little laggy from WebEx. Thank you, Sammy. All right, so here you can see the homepage of the City Health Dashboard. And when you first land on this page, you'll be able to enter a city or state that you're interested in. In our example, we're going to use Wilmington. So in the select a metric pop-up, if you already know which metric you want to explore, you can choose it from this list. If you're not sure about which metric you want to explore, you can click on View Wilmington's Overview for a more high-level review of the metrics. And so here you can see performance across each metric to give you an overall sense of where the city is thriving and any opportunity areas. And you can click into any of these metrics to see additional information about the metric and data source, as well as a thumbnail image of the city's metric map. And so in this case, we're looking at children in poverty. And if we're interested to learn more, we can click on See Metric Detail. So here we are on the metric detail page for Wilmington for children in poverty. And so each metric detail page looks the same, and it offers visual signposts that orient the user to what they're seeing. So if we're looking at the scale bar here, the scale bar shows the range of values for the metric, and the color gradient signals better or worse outcomes. And across the dashboard, metrics with darker colors indicate poorer outcomes, and lighter colors indicate better outcomes. And the blue check mark on the left there with the circle indicates the direction of better outcomes. So for example, in this metric, the lower percentage of children in poverty is ideal, while for different metrics such as high school graduation, a higher percentage would be better. And the gold bar on the scale shows the city and census tract value for a metric, and the navy triangle below the scale indicates the dashboard city average. So to interpret this scale bar, we've provided this statement below it, which in this case shows that 37.9% of Wilmington's children were in poverty, compared to an average of 20.4% across dashboard cities. And finally, the green check mark, which you can see in the legend there, is shown when the city or census tract average is better than the dashboard city average. And the dashboard provides multi-year data for about 29 of our metrics, with some metrics going back to 2012. And so when it's available, you'll be able to toggle between the years at the top of the page next to the metric name. And if you scroll down, you'll see our city map, which allows you to zoom into neighborhoods or census tracts within the city to see the performance and how they compare to one another. In this case, there's a general pattern of higher children in poverty in neighborhoods in the southeastern part of the city. And you can also click into individual census tracts, and their values are shown on the side of the screen under highlighted tracts, and this allows for easier comparisons. And now we're going to look at the demographic detail page. So as you can kind of follow along, we have this navigation bar up top, so you always know which page you're on. And so for this demographic detail page, about a third of our metrics provide data disaggregated by race and ethnicity, and this allows users to investigate any disparities between different ethnicities and overall just get a more complete picture of community health and the types of issues that specific communities face. And so next up, we can explore the Compare Cities feature. So while no two cities are the same and each will develop its own roadmap towards better health, cities across the country are dealing with similar issues or have similar populations. And so we provide communities the ability to see health outcomes and factors impacting health compared to other cities. And you can identify peer cities and compare their performance in two different ways. If you know what city you want to compare yourself to, you can just type the name into the Select Comparison Cities box. If you're not sure about which city to compare yourself to, we have this filter feature that allows you to filter by size, location, demographics, as well as other dashboard metrics. You'll notice that this past summer, we added a new filter based on research we've done on small and mid-sized cities across the US. We categorized our cities into 10 different city types based on demographics, population change, and other factors, which provide for really interesting comparisons. You can find what city type you belong to in the cities that are in your type by clicking on the question mark icon next to city type and then clicking on See More on the city types page. In this example here, you can see that Wilmington is a small industrial legacy city, and it can be compared to cities such as Camden, New Jersey, Gary, Indiana, and Flint, Michigan. So next up is our Compare Metrics feature. So let's say that you wanted to look at the relationship between children in poverty and another metric such as healthy food access. So the dashboard allows you to dig into potential relationships and geographic patterns between these two metrics in a few different ways. First is the metric comparison map. This shows values for both measures on the same map. And as you can see here, the blue polygons represent children in poverty, and the red dots indicate the value for limited access to healthy foods. And in both cases, lower values, lighter colors mean better outcomes. And so you can see a similar pattern in the city center where there's higher poverty. There also tends to be higher rates of people who are not within walking distance of a supermarket or grocery. And while using this tool is really helpful, it's important to remember that correlation does not equal causation. The second way to compare metrics is through scatter plots, which graph each census tract value for children in poverty against census tract values of limited access to healthy foods. And so these visuals can give users a more complete picture of what issues certain communities may face and how these issues may move together and drive outcomes. And up next, we're going to look at the Take Action page. So once you've explored Wilmington's data, you can visit this section, which provides 5 categories of actionable tools created by organizations and websites that are experts in the field to help you drive change in your community. We provide over 200 resources spread across 5 categories. The Find Policies and Programs is pretty straightforward. The Find Partners can help you identify websites and organizations as potential collaborators to help you achieve your goals. Explore Strategies provides guidance for communication, advocacy, stakeholder engagement, and other important tools for action. Find Funding can identify the diverse funding streams that are available to users and provide tips on how to obtain this financial support. And lastly, the Measure Impact tool provides users, help users leverage data to support their work and evaluate their impact. And so you can access the Take Action by the navigation bar up top within your city's page, which automatically filters for any metric and city-specific resources. Or you can access the Take Action page from the main menu on the left, where you can manually filter by metric and audience. And also on the main menu panel, you'll be able to access our data access page, which will be the focus of our presentation today. And so let's dive into learning about accessing our data. Thank you, Sammy. So for our data access page, all our data is available for download. You can find the most recent year of data available via CSV and text files, and you can also access multi-year data by using our API. You can choose to download our complete dashboard city data, or you can select downloadable data files by state. To access our data, all you need to do is click on that data access page that I just showed you all and complete a brief survey if it's your first time visiting our site. And you can, in addition to accessing the data access page on the menu, at the bottom of every page, you'll also be able to see our data access page and technical documentation. And so you can see on the image, there's on the right The top one just shows a screenshot of the survey that will be asked the first time you visit the site, and the second image shows the bottom of each page where you can access tech docs and data access page. And you can always email us for COVID local risk index data. It's not in our downloadable files, but it's really easy if you're interested. Just shoot us an email and we will send over the files. And so here you see the screenshot of where you can download the dashboard city data as a complete data set, or you can download it by state. And as I previously mentioned, multi-year data is accessible through the API. And now I'm going to turn it over to Alex to talk more about the downloadable data files.
Sure. Thanks, Becky. So let's say you have decided to forgo the API and you've chosen to go directly with our downloadable data, and you've elected to download the data directly from the site. So when you download the data, you'll find that you'll receive on your web browser a zip file that will contain these 5 files. You'll have the city level data for all of our metrics, as well as the tract level data for all of our metrics. And this is available in a .csv or a .txt file. We also provide our downloadable data codebook, which provides a lot of information about what exactly you're seeing when you open up the data source and the data set. So the graphic behind all of this is what would our data would look like if you opened it into a statistic programming software. So you'll notice that we have the city name, information on the metric, as well as the EST on the far right represents the estimate. So essentially, the numbers that you see on the dashboard website will be the numbers reflected there. And that's just to give you a little bit of idea of how our data are structured. Of course, you can learn more about what exactly is being measured, how it's being measured, by really diving into the code book. You also notice on the left that there is a column that says STPL_FIPS, and that's what's called a FIPS code. And so what exactly is a FIPS code? It's essentially if the acronym stands for Federal Information Processing System. And the idea is that it essentially is a serial number for each individual geographic extent that the census works with. So the longer that your FIPS code is, the more granular the measure is. So what I mean to say there is that the larger the numbers get, the smaller the spaces. So if you look at our example FIPS codes, the first one, the 01234567890, is a neighborhood level neighborhood level FIPS code, whereas the 0134567 is just the city level. You'll also notice that the FIPS code is structured so that the neighborhood level code contains the state, county, as well as the individual neighborhood level number that you'll also see on the tract level estimate on the dashboard page, whereas the city level number is just the state and then the city. And so what's really the purpose of using the FIPS code when you might say you have your city and state already in mind? What's the purpose of using the FIPS code? So the FIPS code we use specifically because a lot of cities actually have the same name. So for example, Springfield, there are 5 Springfields that are represented on the dashboard currently. And so this helps users be able to match up the FIPS codes for their cities as well as their neighborhoods directly with our data. So that way they're getting the exact information that they need to do any types of analyses. And so what ways are users using our data? You can use it with a lot of different tools, ranging from Tableau, Data Wrapper, different GIS softwares, coding and statistic programming applications, as well as a variety of open data portals. And so, for example, recently the Arkansas Center for Health Improvement used Tableau, and they overlaid some of our metrics, including frequent mental distress, frequent physical distress, and children in poverty, onto their local maps with local school district geographies and school ratings to get a better idea and understand and communicate the impact of social and economic conditions on health and educational outcomes in Little Rock. And so thanks so much for joining us. And we'll go ahead and take any questions that you might have either in the chat or feel free to unmute.
Thank you, Alex and Peggy. I'm just reading over the chat and I will read these and you guys can answer. We got one question from Carrie. Are there any concerns over the completeness of the current US Census data affecting the reliability of the data? This wouldn't be a reflection, not a reflection on City Health Dashboard, just in general, as similar organizations who provide data will be affected by the Census 2020.
That's a really great question. And I'll start, and Alex, feel free to add. This is something that we definitely think about a lot, like what are the data sources that we use? And I went over some of the criteria earlier. Something I will add is that throughout our site, at the bottom of every page, we do have tips and cautions for users that could be specific to the specific metric or the specific city or the year that you're looking at. And so I would say that we really try to provide these tips and cautions to help guide users on ways to use the data.
Yeah, definitely. And I think I agree with everything that Peggy says. I also want to note that when we are working and scrutinizing all of our data sources, we do also, if we ever have questions or concerns about our data, we do work directly with a variety of different partners, whether with government organizations who are collecting the data, so folks over at Census, as well as our other federal data sources. We do work with them to make sure that what we're representing accurately reflects what is meant to be represented.
Great, thank you, Alex. And we got one question. How do you define a neighborhood for the FIPS code?
Sure, that's a great question. So we use, in alignment with many researchers across the country, we also use tract level data. So the FIPS codes that you'll see in our data set are the 11-digit tract code, which contains the tract, the county, as well as the state.
Awesome, thank you. And then we just got a question. Will you be adding more cities in Oregon? I would like to use the comparison option, but there's not a large representative sample. That's a great question, Kathy. I can answer that one. So we are always trying to add more data and add more cities onto the dashboard. When we started in 2018, as Peggy mentioned, we had 500 cities. So any city with a population of over 66,000. And then this past summer or this past year, we've been able to kind of decrease that threshold to include all cities with a population of over 50,000. And so that increased our city number to 750, around 750 cities that are now included. And, we're always, like I said, we're always trying to find, new data sources, new ways to include these cities. But unfortunately, at this moment, we are limited by the data sources that we use. They're all national data sets, and sometimes those data sets don't have data for smaller geographies or smaller cities. But again, if you have, if you want to point us to anything or talk to us about, adding more cities in Oregon, we're always, happy to talk to people and get more information about ways we can do that. Oh, this is another great question from Ed. How do you define a city? Does this include a metro area? I would think that was a plant, but it was not a planted question.
Peggy, do you want to answer this or do you want me to?
Go for it, Alex.
Okay, so that's it's a great question. And this is something that we think about quite a bit at the dashboard, especially the data folks, because a city means a lot and can mean different things depending on where you are. For the purposes of the dashboard, we use a specific extent with the census called the place level, which is most closely aligns with what the census believes is a city. Now, that typically will not include metropolitan statistical areas or MSAs, um, because those will typically include suburbs as well as unincorporated territories that are not represented within the city extent. Usually, we'll think of the city as a space where that specific government will provide specific services to those areas.
We have one more question in the chat. Are all of the indicators available for every city and tract? What percentage is not covered in the dashboard?
Sure, I can start on that one. So almost all of our metrics are available for all the cities on our site. When we originally launched, we started with the 500 largest US cities. So a couple of our data sets, such as the CDC's 500 cities data set, and the metrics that go with that one, those data are only available for the 500 largest cities. So some of our smaller cities, the 250 that we added, may not have data for some of these metrics. And I don't have a percentage off the top of my head, but you will be able to see on the site if it ever says data are not available for smaller cities or something like that. That's what it's referring to. But we try really hard to obtain data for cities of all sizes on our site.
And Ed comes into the chat with another question. Can you combine cities to look at a metro area?
Yeah, so I say yes with a caveat. That's definitely possible to do that. I think the limitation would be if you're using only our data to make sure that all of the cities within what you feel is your metropolitan area are represented on the dashboard. With that said, I think that, yeah, it's definitely possible to do that.
And this is Becky from the dashboard, just adding that on the actual dashboard, you can compare cities for individual metrics, but to look at, more than one measure for multiple cities, you would have to do that with the downloaded or data or API.
And we have another census city quandary question. The census recognizes, as an example, Kansas City as a city, but then as we referenced, it has cities within the larger city. Are the metrics for Kansas City going to be all inclusive of the cities made up of Kansas City?
That's a great question. I actually don't know if I know the answer to that. Peggy, do you know?
I don't know the answer off the top of my head, but I would say that with Alex explaining the FIPS codes earlier to refer to that unique identifier for the different cities, and that would help users know what the geographic boundaries are corresponding to that unique FIPS code for Kansas City.
And this might be a place just to mention some unique cases, like where cities and counties have the same boundaries and consolidated cities. Peggy or Alex, if you want to chime in there.
Yeah, sure. Yeah, there are some cities that we have represented on the dashboard, which are considered consolidated cities, which are essentially cities that use their county as their as their geographic boundaries. So there's a little bit of mismatch in terms of what the census defines as a city and what the city defines itself as a city. So for those, there's a few caveats with the data that we use, but for the most part, when it's a census derived metric. We use the census definition of the city. There are some other situations where we use the county level. And then like with those unincorporated areas that are technically outside the extent of the city but receive services from the city, those are like those portions would be represented on the dashboard.
I'll just quickly add that if you were looking at Kansas City on the metric detail page, the map will also visually show you the boundaries of that specific geography.
We just have a comment from Carrie looking at St. Louis. Blackjack and Spanish Lake are cities within St. Louis, but they do not have their own zip codes and often share the same zip code with Florissant and St. Louis proper. This can make it especially challenging to gather metrics. You hit the nail on the head, Carrie. This is all very challenging stuff, and it's questions that we're asking ourselves and challenges that we're trying to solve and figure out here, almost on a weekly basis, it seems. We're trying, but, a lot of great people are doing this work. So hopefully, with us and the other tools available, we can help make this stuff a little bit clearer for people. Okay, those are the questions that are in the chat. If anyone has other questions, either, drop them in the chat or feel free to unmute yourself or speak up. Oh, we have another question. I see a few indicators on our city's dashboard where data is not available, but I'm wondering if you ever withhold data due to high margin of error, and if so, how do you decide that? Another great question. I will let Alex and Peggy take that one.
Yeah, that's a really excellent question. Off the top of my head, I would say that we try to be as transparent as possible and make the data as accessible as possible. But issues with unreliability of the data, high margins of error, the biggest example I can think of would be around our vital statistics data. And so those are from the National Vital Statistics System, which has its own type of data suppression criteria that we follow. And so for the metrics that fall under that, there is some suppression, and all the information about the specifics of our suppression criteria for this data can be found in our technical documentation, which really meticulously records metrics information on every metric. Alex, did you want to add?
Yeah, I was going to say actually exactly that. The tech doc or the technical documents, we shorten it to tech doc. It will also give you in-depth explanations of how each calculation is derived. So if you ever have like concerns or like questions about the specific like margins of errors that we use, why we elect to use a 90% confidence interval instead of a 95, that a lot of that information is provided there.
You can keep sending questions in, or like I said before, feel free to unmute yourself and ask them live. Yes, and Becky mentioned in the chat that you can always send us questions or comments or concerns at info@cityhealthdashboard.com, and that's a great way to reach out to us. That is not an email that goes out into the ether. We regularly check that. I'm the one who checks it, so you'll be emailing me. And I love to talk to people. So definitely never hesitate to reach out about anything. And we hold these virtual office hours every month. Each month is a new team, or sorry, a new theme and topic of focus. Next month we'll be diving into our COVID local risk index, which Peggy mentioned earlier on the webinar. We released that data back in June. Which was a very exciting addition to the dashboard, one that is obviously very, very relevant to what's going on right now. And so we will be kind of looking at lessons learned from releasing that data, from analyzing that data, and discussing potentially some updates to that metric. So that'll be next month, and it is on Thursday, November 19th. My mom's birthday, so it'll be a good session.
And just to note, that's also why we have the COVID local risk index as a separate data set that you can just email us for at that email address. And we're happy to send it just so we can track who's using it in case we do have updates. We can let you know once we have those updates to the index.
Yep. Thank you, Becky. If there's no other questions, the dashboard team will stay on the line. There's one came in. What time on November 19th? The virtual office hours will take place at 2 p.m. Eastern. We will post it. So the registration link is on the page that Becky dropped in the chat. On our website page, but we will start posting about that closer to, and we always send emails to our listserv with a little blurb about what we're going to focus on, as well as links to register. So more will come from our email there. Thank you all for joining us this month.